This is a cough, but not all coughs are the same.
First, cold cough.
Runny nose, sneezing, sore throat caused by a virus.
So antibiotics, no.
You treat the symptoms. Antihistamines, decongestants, that's it.
Next, dry cough. No mucus, just tick, tick, tick irritation.
Usually from allergies, dust, or early infection.
So what do you use? Cough suppressants, like dextromethorphan, because there's nothing to bring out. Now, wet cough. This one has mucus, thick, sticky, productive.
So you do not stop it.
You help it come out. Use expectorants like guaifenesin or mucolytics like bromhexine.
So remember, dry cough, stop it. Wet cough, clear it. Cold cough, treat symptoms.